If someone is convulsing around you, don't put water in their mouth, don't press them down, and don't put anything in their mouth. Welcome back to our convulsion series. If you have not watched the previous video, make sure you go back and watch them. And don't forget to subscribe to our channel, turn on your notification buttons, and be the first to have these notifications when we drop our new videos. If someone is convulsing in front of you, I'm sure a lot of people will panic, they'll be afraid, they will do a lot of crazy things. But never worry, stay calm. I'm going to tell you exactly what to do. When we say somebody is convulsing, what does it mean? It means there are abnormal electrical activity occurring in the brain. Convulsion occurs in the brain. It's just like electricity. It's like high voltage electricity that is shocking in the brain, and it is in a high voltage. That is why it's accompanied with jerky movements of the body. It's like high energy in the brain, excessive energy that the brain can take. So the body reacts by movement. That is why it will be unwise to be holding the body, because the defect is in the brain. So during a convulsion, the person is not aware of his surrounding. The person is off. They are not aware. They are not hearing what you are saying. They cannot talk. They are not in control of their body. You are not trying to wake them up. You are rather protecting them from being injured until the brain starts functioning well. So always note, during a convulsion, you are not trying to stop the convulsion, but you are protecting the person from having an injury until that convulsion stops and the brain comes back to normal. So, if you see somebody convulsing around you, I want you to remember this word fast. F-A-S-T, fast. So, what am I going to do? Before we start talking about the word fast, number one, you need to stay calm. You don't need to shout, you don't need to panic, you don't need to do crazy things around there. You need to tell yourself, I can handle this. Take a deep breath and tell yourself, I know what to do. Just the confidence is going to help a lot in saving that patient's life. So let's go. Number one, F. What is the meaning of F? It means that you should free the atmosphere. You need to get away any dangerous objects, because sometimes people start convulsing and there are sharp objects, there are stones, there are dangerous objects around. So what are you going to do? You are going to free the environment. You make sure that there is no harmful object. You also want to help the person put a soft something like a pillow or a soft object below the neck, so that the person will not hit the head. The second word is what? A. So we started with F. Now we go to A. A means what? You should avoid harmful or unnecessary actions. What are the unnecessary actions that people do? They get agitated, they put things in the mouth, they give water, they hold the patient. I even see some people carrying a baby and putting the head inside the toilet pot. Crazy things. So you avoid these unnecessary things and you stay calm. So number three is S. And what is S? Is sideward position. So during a convulsion, what happens is that sometimes there's a lot of foam that comes out from the person's mouth. There's saliva, excessive saliva production. And you know what? This foam and this saliva can block the airway and prevent the person from breathing, or actually causing the person to choke. So what are you going to do? You are just gently turning the person to the side, so that gravity will help that fluid, that foam, to come out from the mouth, and you clear the airway and you prevent that person from suffocating and having shortness of breath. But notice, you don't need to do this with a lot of power. You don't need to do it violently. You just gently, because that person is actually convulsing and you don't need to press. So you just gently control the person to the side so that this fluid can flow out of the mouth. Doing this is already life-saving. So the last one is T. And what is the meaning of T? Time. Timing in a seizure is super important. It is of utmost importance. As I mentioned earlier, you need to time the period of the seizure or the convulsion. When it starts, you put on your clock or you see the time, so that you'll be able to know when the convulsion stopped, and you are able to tell us if it was 1 minute, it was 2 minutes. Normally, convulsions will stop before 5 minutes. Most convulsions will stop before 5 minutes, and it's normal. The person will just recover normally. But when the convulsion starts going above 5 minutes, or the convulsions start and before they want to complete, they have taken over again and they go above 5 minutes, we know that there are abnormal convulsions. So make sure you take the time, make sure you film the person. If the person is convulsing, you take some images so that if you're coming to the hospital, we'll exactly experience what was happening. And then finally, always make sure that you lose any tightening cloth and you stay with the person until the person recovers. Sometimes people may be convulsing and they have tight clothing on themselves, so you make sure you are helping that person. If the person is having some tight clothing, you can loosen so that the person will feel free. The person should not be tied up in those tight dresses, and make sure you stay with the person until the person recovers. So when you have a seizure, after a seizure or a convulsion, as we may call it, you always have a confusion state, and that confusion state, you need somebody to be with them. So you are going to ask the person, are you okay? Is everything okay? Do you have any pain? You talk with the person to evaluate and see that that person is reasoning well. You call the name. What's your name? Are you feeling okay? Is there any problem? Most of the times they may not even remember what happened before. You can ask them, do you remember what you were doing? And you are sure that this person is okay. If you are doing this, you have done the right thing. And you always remember fast as the first aid step to take when somebody has a seizure. In the next series, I want us to discuss on how to identify a seizure or a convulsion. Most people don't even know that somebody is convulsing. The fact that somebody falls down does not mean he's convulsing. So in our next series, we'll look at how to identify a convulsion.